Hi, my name is Dr. Joe Sirven, and I'm going to be presenting a lecture on headache evaluation and when to worry. Now, as a sake of full disclosure, I want to note that I am not a headache specialist. However, I do see a lot of headache, and I think after you hear this presentation, you'll be able to handle the vast majority of the cases that come down your road. I want to also acknowledge my colleague, Dr. Rashmi Hawker, who guided me with regards to putting this talk together. So I want to thank her for her efforts in helping me. And I also want to thank the organizers of the course, Maisha Robinson and Devin Rubin, for allowing me this opportunity to speak to you all today. Let me put this on presentation mode and we shall go forward. So the main thing that I want to convey is, when do you worry about headaches? Everyone always worries, is this an aneurysm? Is this a tumor? Is this something else? When do you have to stop and do all of the testing versus say this is likely some other issue? And that's what I'm really going to serve in my objectives to try to show you today. Here are my disclosures. They're all mostly related to work with my subspecialty of epilepsy, for which I've been doing for almost more than 2 decades. So I list my disclosures there for your review. So when you distinguish primary from secondary headache disorders, the main thing is looking for red flag warning signs. Are they present? If so, that's a secondary headache and you have to do something about it. If not, this is a primary headache disorder, and that's going to kind of lead you to a different element and lead you to the diagnosis, and more importantly, therapy or treatment for the patient. So when do you worry? Well, it's about the red flags. And the most important way to convey those red flags in a group setting is the following, or SNOOP4 red flags. SNOOP4 stands for systemic disease or symptoms. That's looking if there's a previous history of malignancy, fever, weight loss. Are there neurologic signs or symptoms that come along with this? Is the onset of the headache sudden, acute, or thunderclap? Is the onset after age 40? Because the older you are, the more unusual it is to have a primary headache disorder emerge as the first time at that point. Is there a previous headache history with new or different headache features? Is it a progressive headache? Is it associated with posture, which is going to lead you to a certain level